Is the miracle, quote-unquote, fat cure millions of Americans dreamed of available now? It's called Lipodissolve. It's said to make fat melt away without surgery. Coming up, we're going to see if the procedure's risks outweigh potential rewards. Welcome back to the early show. Also ahead, Capitol Bob weighs in on Barack Obama and Hillary Clinton's verbal fisticuffs. We'll talk about that in a little bit, too. And in Health Watch, a report on the life-saving effectiveness of implanted defibrillators. First, though, here's Julie.
Thanks, Harry. Wouldn't it be nice if you could just melt away your excess fat? CBS News correspondent Kelly Wallace is here to tell us more about a procedure that claims to do just that.
Oh, Julie, wouldn't it be nice?
It would be.
Well, this is called Lipodissolve, and as the name implies, according to doctors who perform it, it's expected to dissolve away the fat. Relatively new procedure here in the United States, but it's gaining in popularity. Here's a little bit of a catch, though. There are some plastic surgeons around the country who are questioning if it really works and if it's safe.
And what we'll do is have you sign every time you come in for a treatment, okay?
44-year-old Scott Kirby wants to lose a couple of inches around the waist, but he's not willing to go under the knife to do it.
I don't think I could ever be interested in the surgery side of it. That wouldn't be a choice I would make.
So he's having a procedure done that's billed as a non-invasive alternative to liposuction called Lipodissolve.
What makes you an ideal candidate is that it's a localized area of fatty tissue. It's not like
Dr. Roger Friedman is the medical director of MedSculpt, a new Lipodissolve clinic with offices in Maryland and Virginia.
Is it liposuction without the risks?
It's very different, and the real difference is volume. We're not doing volume, we're doing inches. It doesn't require an anesthetic, it doesn't require a hospital visit, it doesn't really require recovery.
How does it work? Think of it as a series of injections all designed to melt the fat away from those problem areas. In Scott's case, his belly.
Lipodissolve is a technique by which we're injecting a material into the fatty tissue. That liquid dissolves the fatty tissue, creating a local inflammatory reaction, which means that you're going to get some swelling, you may feel some lumpiness, and then over time, that fatty cells will dissolve.
The procedure involves dozens, sometimes more than 100 injections at one time. Patients typically receive a minimum of 3 treatments over the course of several months.
We tell people that they're going to lose about a ½ inch or more per treatment. So a person may say, gosh, my waistline was 38 inches, now it's 35.
The solution that's injected into the body is called PCDC. Though the formulation can vary, one of the main ingredients is a bile salt, which helps break down fat. Although the procedure has been performed in Europe for over a decade, PCDC has not been approved by the FDA.
We are the first ones to tell patients who come in that it is not FDA approved. We do share with them the European experience and then give them the choice of whether they want to proceed.
But many plastic surgeons have serious concerns.
We don't know how it works. They're surmising how it works. We need to have proof before, in good conscience, we can recommend it to our patients.
Dr. Alan Gold is incoming president of the American Society for Aesthetic Plastic Surgery. He says there's no scientific proof that the injections are safe and that they work.
We shouldn't be experimenting on our patients. We should be able to assure them that what we're doing for them is safe.
While MedSculpt says it's treated 500 patients since January and no one has complained of unsatisfactory results, Dr. Gold says it's not a risk-free procedure.
They may have seen good results. There are certainly complications. There are infections. There are areas of skin death over the areas that are injected.
Is it something that strikes you as maybe too good to be true?
No, I hope it is good enough to be true. But we would all feel in organized plastic surgery much more comfortable if we understood how it really worked and if it is safe and effective for people to use. So we'll see.
Scott says he's not worried about any health risks. He's just waiting for his inches to disappear.
How does it feel to be on your way to a flatter belly?
Six-pack abs, yeah.
Is that the goal?
Well, I'd like that, yeah. That would be the goal.
And Scott says he's on his way to his goal. In a few weeks, he'll have his next procedure. He's hoping to have those six-pack abs by Labor Day. As for the cost, Julie, treating one problem area, about $2,000.
So where exactly does the fat go?
Well, that is a big question. According to the doctors at MedSculpt, they say it's excreted from our body just like any other waste would be. But some of the critics, like Dr. Gold, say there's no proof that that's the case, and they're raising questions if those fat cells end up in other parts of our body.
Kelly Wallace, I'll stay tuned. Thank you.
Yes, yeah, we'll keep you posted.
All right.